everyone. I'm Dr. Suzanne LeBlanc, the Director of Clinical Relationships at the Focused Ultrasound Foundation. We are delighted to partner with BrightFocus Foundation's Alzheimer's Disease Research Program to bring you this important conversation on Alzheimer's disease and new frontiers in treatment. Before we get started, a few technical items. If your connection is lost, please simply log in again using your registration link. At the conclusion of today's webinar, you will receive a link to the event recording as well. Now, the Focused Ultrasound Foundation is committed to accelerating the development and adoption of focused ultrasound, a groundbreaking, non-invasive therapeutic technology with the potential to transform care for over 200 medical conditions, including Alzheimer's disease. We are currently funding 11 active preclinical research projects and clinical trials that are exploring the role of focused ultrasound in treating and managing Alzheimer's disease. Importantly, we're here today to explore what the science could mean for offering better treatment options for patients, caregivers, and families who urgently need it. With that, I'm pleased to introduce my co-moderator, Nancy Keach from BrightFocus Foundation, which makes an extraordinary impact by supporting research advances to diagnose, slow the progression, treat, and ultimately cure Alzheimer's disease and other diseases as well. Nancy?
Thank you, Susie. Hello, everyone. I'm Nancy Keach, Senior Vice President of Strategic Partnerships at BrightFocus Foundation. And we are a nonprofit that funds exceptional scientific research worldwide to understand and treat Alzheimer's disease and also macular degeneration and glaucoma. We also provide expert information on these heartbreaking diseases. Over 51 years, BrightFocus has awarded over $310 million in research grants worldwide, catalyzing scientific breakthroughs across diseases of mind and sight that have led to novel treatments, prevention strategies, and diagnostic tools. And BrightFocus is really thrilled to be partnering with the Focused Ultrasound Foundation by co-funding research grants. We thank them for organizing today's fantastic panel. So this webinar was inspired by the documentary film Taking Care, which chronicles Lauren Miller Rogen and her family's experience with Alzheimer's disease. And if you've had the chance to watch it already, you know how powerfully it captures the challenges and the resilience of families facing this disease and other dementias. If you haven't watched it yet, we're going to watch the trailer together in just a few moments. So I'll also mention I had the great privilege of being an executive producer on Taking Care and being involved with it since its inception, which was during COVID. And finally, I just have to mention that it was directed by a very special man, my husband, director and producer James Keach.
Thanks, Nancy. And joining us for the conversation are a distinguished group of panelists: advocate and filmmaker Lauren Miller Rogen, neurologist and Alzheimer's prevention specialist Dr. Richard Isaacson, neurologist and focused ultrasound clinician Dr. Paul Fishman, and focused ultrasound researcher and innovator Dr. Isabelle Aubert. Together, they bring perspectives from caregiving to clinical care and cutting-edge science.
We'll begin with reflections and discussion with our panelists and then open the floor to your questions. And with that, let's begin the program by watching the Taking Care trailer together.
You have a beautiful photo of you all with your mom at your wedding. So she approved of this bum.
She loved him. Oh my goodness.
For a Jewish mother, I'm like your jackpot right there.
And your name is?
Adele, I think. My parents had a really lovely marriage. My mother has seen some people treat me with not a lot of respect. And then Seth came along. He was just different.
It was like my first serious relationship as well, really, you know?
He treated me in a way that made me feel how I had never felt before.
Early on in the relationship, Lauren seemed pretty sure that there was something changing.
It was the first time I said out loud, something's not right with my mom.
When we got the official diagnosis, you have Alzheimer's. Adele was distraught, and she swore me to secrecy. She was ashamed.
Never seen anything like this. This is so far beyond what I ever thought this disease was capable of. And the only thing that made it manageable for us was that we had money.
It's not fair. People that have given up their jobs, their friends, all to care for their loved ones.
Yeah, I mean, was really looking for some sense of control. All right, are you guys ready to get this show started? Someone suggested, why don't you put on a comedy show and give the money to an Alzheimer's charity? Maybe that'll make you feel like you have some control over the situation.
Hi, everyone.
Comedians especially are willing to give their time and energy to a good cause.
As soon as Seth asked me, I got this amazing charity, and you could come by, do a set, give your time, or you could donate some money. And I was like, I'll do a set.
Is everyone okay?
I'm killing this room, Seth. I got this room on fire.
In retrospect, seems like it was some vision we had for how to balance lightness and darkness, but it really wasn't. It was much more desperate than that.
You can't get back what is gone.
Thank you. And I'm now delighted to introduce Lauren Miller Rogen. Lauren is a screenwriter, director, producer, philanthropist, and truly a passionate advocate. She co-founded Hilarity for Charity, which has harnessed humor and hope to inspire a new generation of Alzheimer's advocates. Since its founding, the organization has raised more than $18 million and provided over 400,000 hours of in-home family care. Lauren, we are so grateful to have you with us today. Welcome.
Thank you. Thanks for having me. I'm so happy to be having this conversation with such an accomplished and thoughtful and intelligent group. Speaking of, look who just joined us.
Oh, hi. Hi, Dr. Isaacson.
Hey, everybody. Good cue. Thank you. I don't know what I deserve to deserve that, but nice to see everybody.
So we just finished watching the trailer, and Lauren, we've been working on this project for, I think it's over 5 years. And I have to say that I have never seen you watching any part of this film. I know how hard it was for you to watch. I know that your dad, Scott, who's in the trailer, I don't even think he's seen it yet. What was it like for you sharing such a personal story with the world through taking care?
Yeah, I mean, it's many things sharing such personal stuff, right? When I first was like, oh, I want to make a documentary, it was because I wanted people to understand, and I wanted to share what was happening inside my house, because I thought, oh my God, most people in my life at this moment don't have any idea what this disease is. So on one hand, sharing it is the goal, and it's what I wanted, and accomplishes understanding among people that don't have a vision. At the same time, it's also very personal. And of course, it's, this was a 16, 17-year journey for my family. It was a really long road that we walked, and it was full of a lot of low points and high points as well, like the creation of Hilarity for Charity in general. But it can be hard, and it's like sometimes when I talk about this stuff, I can just be like, this is what happened. And then other times it's like, oh, that came out of nowhere and it hits me, and it's like, oh God, this was a lot, but mostly for me, sharing it is fulfilling in a way that I wanted it to be, because I feel like I've taught people what this disease really looks like. And, and my mom was a teacher, and I think at the end of the day, what she would want is for people to learn. So I think that's what we've done. And so, it's ups and it's downs and all of it.
And there have been about, I think, over 480 screenings in schools. And so that's an amazing accomplishment.
I didn't know it was that many. That's incredible. That's
488
great.
to be exact. But
okay.
So from your perspective, And how old were you when when you started to see signs with your mom?
I first saw signs at my college graduation. I was 22. And then, then it was a couple years and she was diagnosed kind of diagnosed in and out a few times or whatever. Around when I was 24, 25, she was 54, 55.
And so from your perspective, that perspective, what's the most misunderstood aspect of living with Alzheimer's?
I mean, I feel like that there's sort of two things. First, there's a misunderstanding of what it means to lose one's memory. I think that like a lot of people, unless they faced it firsthand, they don't quite understand what that means. And they think like, oh, you've just forgotten a little something and then it'll come back. But to lose one's memory really means you've forgotten how to function as a human. And you forget how to walk and talk and eat and dress yourself and care for yourself. And so I think that is misunderstood, partly because I feel like film and television lacked accurate portrayals of what the disease looks like, and it made light of things, and it'd be like, oh, someone misplaced their keys or they put on their shirt backwards and, kind of made light of it. And that's not a blanket statement. Of course, there were some accurate portrayals, but like it's been a long road to it being accurately portrayed, I think. And so I think that's part of it. And then the other side of it is, again, unless you've lived it, I don't think you have any comprehension what it's like to take care of someone with dementia and what caregivers go through and what their lives look like on a daily basis. It is extraordinary when you are full-time caring for someone. And so I think that, it's all just hard to understand unless you've lived it. And so I think that, but it's why it's important to understand it, right? Because we have to understand what each other are going through in order to help each other.
And I know one of the reasons you really were adamant about doing this was that you were experiencing this as a child, or even before 22, because your grandmother had.
Mm-hmm.
And people think it's an old person's disease; it's only affecting older people. And
right.
You really wanted to go out there and say this is affecting our young people as well, and you have to prepare for this. And so, how do you feel that advocacy and public storytelling can influence understanding and the pace of research and funding?
I mean, you can look back, I think, historically on all major diseases, and it was like when they were in the dark, they didn't get funding. And then when they were brought into the light, they did. It's like I wasn't alive in the time when people whispered cancer, but like I've seen it portrayed and I understand that like that's eventually stopped. And, all our products turned pink. And, we're talking about breast cancer, and therefore funding appeared and research appeared and treatments appeared. And, the same as and again, these issues aren't gone, but like you look at HIV and AIDS and heart disease, these are conversations that people weren't talking about at one time. Then they became normalized. Thus, funding came, research, treatments, et cetera. And, and dementia is something that, it's hard. I would say it's hard because I'm so inside of it. So I don't know, but I feel like in the last 5 or 10 years, it's really, I think, come out of the darkness in a way. And I think that the funding has, from when I started talking about this to now, funding has greatly increased. Still not enough, but, but that's because the conversation is happening. And so that's why it's so important to not keep these things in the darkness, because no one's going to do anything about it if no one knows about it.
100%. Thank you so much. Thank you, Lauren, for sharing your story. And to continue, we're joined by Dr. Richard Isaacson, who also appeared in the film. Dr. Isaacson is a preventive neurologist and serves as director of the Institute of Neurodegenerative Diseases. Before that, he directed the Alzheimer's Prevention Clinic at Weill Cornell Medicine and New York Presbyterian, where he pioneered approaches to reduce risk and delay the onset of the disease. Welcome, Dr. Isaacson.
Thank you. Thanks so much. You just had a flashback. You talked about the Alzheimer's Prevention Clinic in Cornell, and I had a flashback of me meeting Lauren on the street, traffic zooming, and then she didn't even introduce herself. She just said, "Here, take my blood." So that's how I got to meet
that
Lauren.
fast, but close enough, I guess.
Um, well, we've known each other for a while. From the time Lauren's talking about when there was very little funding for this to a lot of research being done now that there is some funding. How has the clinical understanding of Alzheimer's evolved over the past decade? I think you're very outspoken about this, and it's really wonderful.
Oh yeah, what we were doing. I've been getting tomatoes thrown at me since 2007, so it's almost been 20 years. But I'm so shocked of what's changed in the last decade. I thought, like Lauren, like remember we used to do all these cool things and the testing and the 80 blood biomarkers that were not brain markers, but body markers. We used to do body composition and this and that. Like we had hundreds of data points. That was like black and white television era. Like we are entering high definition TV. Like we are in 4K, like anti-glare 4K. My new Samsung was very expensive, and that's what it is. So I can't believe the fidelity. Like we are doing, proteomic markers, which is looking at protein markers in the blood. And you've heard about the amyloid and the tau. We use multiple different instruments. One uses one technology. One is chemoluminescence, whatever, that's a big word for shining light through the fluid. We are running hundreds of markers, and Lauren won't get into too much detail, but it's amazing. We have hundreds and hundreds and hundreds of markers on people and their families, and it's amazing the fidelity. We were living in the dark ages back then, and now what we do is when we make a recommendation, the term I use is we're trying to develop the cholesterol test for the brain, and at ind.org we're trying to develop these tests. And you're right, the funding used to be horrible, and it's a little bit better. It's still not the best, but we're doing better. We're doing better, and that's good. And I can't believe the fidelity. And when we recommend something, we have women that start on hormone replacement therapy. And I've thought for over a decade that hormone replacement therapy is brain protective, especially in women that have the ApoE4 variant of the ApoE4 gene, or the ApoE gene. And now we have women between the age of 42 and 67. Yes, at 67, yep, you can start hormone replacement therapy later. Heard it here first, but controversial. We just presented data at the Alzheimer's Association meeting showing that in this group of women, their tau protein levels are decreasing. Their amyloid is not getting worse. This is the new frontier. We're not living in a fool's paradise anymore. We have clarity, and we couldn't see before. And great, yeah, cognitive testing was getting better, and cholesterol was improving, and Lauren was happy because her muscles got bigger, and she's all excited about. She looks better. Okay, great, that's great. But everything is improving in these people, and brains are growing. This is real. This isn't fake. So. Yeah, we just have fidelity now and the ability to see, and I couldn't be more excited. I just wish that we could get this out there to the masses, and that's really the next phase.
We're working on that. We're all collectively working on that. And you are also known as something of a guru on risk reduction strategies and prevention. So, for all the people who are listening, what are the prevention or risk strategies that you think show the most promise today?
Yeah, well, there's no one size fits all approach, but to me, it's really a combination. And the data we just presented this summer, the multimodal approach, exercise, nutrition, sleep, hygiene, stress management, managing vascular risk factors, high blood pressure, high cholesterol, diabetes. As the belly size gets larger, the memory center in the brain gets smaller, and that's metabolic problems and insulin and fast forwarding amyloid. That multimodal thing where we focus on vascular risk factors plus good old-fashioned lifestyle changes. You can't eat a magic blueberry and think you're going to prevent or cure Alzheimer's, but you can do Mediterranean-style diet, for example, lowers Alzheimer's risk by 35% in the highest risk category of people with 2 copies of the ApoE4 variant. That has the biggest magnitude of effects in terms of these biological markers that we see now, these amyloids, the tau, and we show significant improvements in amyloid. The other thing that we're developing, and this is pretty cool, and this is very new, but alpha-synuclein. Alpha-synuclein is the protein that builds up in the brain of people with Parkinson's and Alzheimer's. And Dr. Fishman, I'm sure you know about this. My brother's a Parkinson's specialist. My brother's brother-in-law is a Parkinson's specialist. My brother's son is a Parkinson's specialist. And Lauren's uncle, I think, saw my brother 25 years ago, which is what a small world in Boca Raton, which is crazy. We are now looking at blood markers of alpha-synuclein protein. developing them as we speak. We do skin biopsies that are pretty cool, and there's DAT scans. So what we're doing is we're tracking all this in real time. And you heard it here first, and we did present this, so I can talk about it, not published in a manuscript yet. I don't know what this means yet, but the alpha-synuclein proteins are actually improving more so than the amyloid and tau proteins. So I don't know what that means. I don't know if we're reducing risk of Lewy body or Parkinson's, but I don't know, something's moving, some biological effect of lifestyle and other GLP-1s, for example, the GLP, the Wegovy's, the Ozempics. I have nothing to disclose, no relationships with pharmaceutical companies or supplements or vitamins, but I don't know. So I think the question here is, how do people get education, information? HFC, Hilarity for Charity, came up with an amazing site, HFC Universe, which I think I've done some interviews for. And unfortunately, Professor Seth Rogen beat me on the head-to-head randomized controlled trial. Like, he's a better teacher than me, like killing me. Like, I've been talking to my therapist about, I was like on faculty at Cornell, but Seth beat me in the randomized trial. But, there's lots of education out there. We do lots of education. We have free resources. HFC has actually helped fund a little bit. RetainYourBrain.com. It's a free NIH funded site that people can learn their risk factors and manage risk factors for Alzheimer's. And there's so many things that we can do right now. Knowledge is power, and there are resources out there, and you just got to know where to find them and get them.
I think I'm going to jump onto your plugging and say, we just did at BrightFocus, we have Zoom in on dementia and Alzheimer's, and we just did an episode on GLP-1s and the promise of GLP-1s and Alzheimer's. And we look at all these different, because as you say, so much is happening now. And for today, I really wanted to ask, how do you see the role of lifestyle interventions alongside emerging treatments like focused ultrasound, why we're all here together today?
Yeah, so, I've never been asked about focused ultrasound in a public thing like this. Okay, non-published data. So let me start by saying that. I'll also start by saying I was, confused, skeptical, didn't know what it was. Okay, does this really work? Why Alzheimer's? Okay, blood-brain barrier. That was me like a decade ago. We have a trial where we follow people with blood testing, blood biomarkers, amyloid, tau, alpha-synuclein, inflammatory markers, whatever. And we have a guy that's in this trial and his father. The father has Lewy body, ApoE3/4, and the son has early Alzheimer's, believe it or not as healthy, ApoE4/4. And he's on lecanemab, an anti-amyloid drug. And he's in a separate trial that actually, the dad's on donanemab, actually. So it's like this whole thing, the dad has Lewy body and Alzheimer's. Anyway, we actually have biological data in our cohort of two people, a father and a son, that are both on anti-amyloid drugs, and I've never spoken about this publicly, and we haven't published it, so there's the other caveat, that we now have these blood biomarkers, and holy cow, my jaw dropped. The guy got what was it? I'm paraphrasing. It was baseline, 1 treatment, and then 5 treatments or something like that. I don't know what the treatments are because I'm not an expert at this, but whatever the treatment was in this pilot study that was done on the West Coast, I could not believe the change. And, this is imperfect data, an N of 2 study, we need more data, but I just could not believe that. I think focused ultrasound plus the anti-amyloid drug did something that I was absolutely shocked about. So, need to replicate this. And I'm the furthest from the expert in any of this. And I, talk to your doctor and all that kind of stuff, but I'm interested. I can't believe what I saw.
Well, your doctor is right here to talk to, so I'm going to turn it over to Susie to talk to Dr. Fishman.
Great. Cool. Thanks, everybody.
Thank you.
Dr. Isaacson, your expertise and your passion helps us all better navigate this really complex journey. So thank you. And to build on that, we're fortunate to have Dr. Paul Fishman with us today. He's a neurologist at the University of Maryland who has led many clinical studies with focused ultrasound for varying brain pathologies. And he's going to share his perspective on how focused ultrasound can transform the way we treat and manage Alzheimer's. And Dr. Isaacson, he's going to really talk about that blood-brain barrier and how we can get more of those drugs that you're seeing the decrease in biomarkers with across the blood-brain barrier. And even if you're not a radiologist, you're going to see some pictures that will astound you. So stay tuned. And then after that, we're going to have a short discussion with him to unpack more details.
I'm Paul Fishman. I'm a neurologist at the University of Maryland, and I'm going to talk about a new technology called Focused Ultrasound and how it might apply to treatment of Alzheimer's disease. This technology has really been clinically available for about the last 10 years, and it focuses sound energy. It actually goes through the skull, and it can impact brain. When you use a large amount of energy, you can destroy localized pieces of brain, and that's been very helpful in the treatment of essential tremor and Parkinson's disease, and in being studied for chronic pain. That's with a lot amount of energy to the point where it heats up brain and coagulates a small bit of it. So it's a way of doing surgery without opening up the skull. With low amounts of energy, one can kind of interfere with the normal activity of brain, and that's used kind of as a training paradigm. This low intensity thing can maybe modify behavior, and it's used in treatment for depression and perhaps even drug addiction. What I'm going to focus on is using medium amounts of energy in a pulsed way to open up the blood-brain barrier. So the question is, what is the blood-brain barrier? Well, many of the high-tech therapies that you hear about for Alzheimer's disease and related conditions, things like antibodies, gene therapy, growth factors, all of these substances, these molecules, are too large to go from blood to brain because the lining cells of the blood vessels of the brain are basically sealed shut. They're all connected together, and they really regulate brain environment very closely, so that only about 1% of anything that you put in the bloodstream ever ends up in the brain for some of these large things. Well, it turns out that if you use just gas bubbles are used as to give you better pictures when doing diagnostic ultrasound. But when focused ultrasound hits those gas bubbles, they vibrate so intensely that they separate the blood cells that are lining the blood-brain barrier, that make up the blood-brain barrier, and allow substances to cross from blood to brain. This is not yet an FDA-approved method, but is involved in several forms of technology, particularly for improving treatment of brain tumors and perhaps allowing some of these high-tech therapies to get into brain for neurodegenerative diseases like Alzheimer's disease. In terms of some of the new high-tech therapies, what's been on the market for the last 3 years are antibodies that can remove the toxic protein in Alzheimer's disease called amyloid. And even though about, again, less than 1% of these antibodies go from blood into brain, they can dramatically reduce the amount of amyloid. And the amyloid on the right, that's an Alzheimer's brain, lots of amyloid signal. A control brain has very little. And the clinical studies that have been done of these monoclonal anti-amyloid antibodies show that over the course of a year, year and a half, they can eliminate at least 60%, maybe more. But the clinical benefit is much smaller. The rate of slowing is about 30%. And when you look at how different people are from their baseline in terms of their thinking abilities, they're only about 10% different. So the question is, how can we magnify that form of therapy? Well, it turns out that opening the blood-brain barrier allows, and we think it's due to the fact that we all have some natural anti-amyloid antibodies with focused ultrasound in animal studies, but this has been repeated on several occasions. One can go to these little black blobs in the brain of a mouse on the upper slide. It really cleans it out. And again, more than a 50% reduction in amyloid content in the brain, with improvement in these animals using focused ultrasound. And of course, the question is, what happens in people? Well, if you open the blood-brain barrier in humans, and it's been done probably at least in 50 patients with Alzheimer's disease, it can be done safely. Nothing bad has happened so far. but the reductions are kind of modest. You can see they're only a few percent, anywhere from 3% to 10%. But what happens, as I mentioned, these antibodies, only about 1% of them gets into the brain. What happens if you combine it? And there's been one group of patients, only 3 patients published so far. This was of, you may have heard about these patients on 60 Minutes. They were published in the New England Journal because there was a dramatic reduction in amyloid in a short period of time, even compared to the antibody alone. And this is one of the early antibodies called aducanumab. And this passes what I call the eyeball test. If you look at the area that's red, that's lots of amyloid, that's being treated with focused ultrasound, just a 6-week period, there's been a dramatic loss of them. Blue is good. It means that's close to normal. And even compared to a regular treatment, not placebo, opening the blood-brain barrier dramatically accelerated. These patients had quite a bit of amyloid, more than average. So the question is, that's going to be pursued. Can one accelerate and amplify the current therapy using focused ultrasound? And it also opens the door to look at other therapies in combination with focused ultrasound. We're just seeing the beginning of this technology having an impact in things like Alzheimer's disease. And I'm really excited to see what the future is going to bring. And maybe after all the things that we've heard about in terms of prevention of Alzheimer's disease, it would be really nice to see something that reverses those changes. And so those are the things I'm optimistic about in the future. And I want to thank everybody for their time and attention. And I'll be around for a while to answer questions.
Thanks so much, Dr. Fishman. I do have a question. Can you talk a little bit about the fact that now we have this blood test that people can get to detect if they have early Alzheimer's? So I'm thinking if we can detect it much earlier, and then we could do something like focused ultrasound to get rid of that amyloid and potentially tau load, could you bring the brain back to a state where it's staying asymptomatic or asymptomatic? Where do you think this fits into the paradigm with that new blood test?
Well, there's actually a fair amount of peace between the prevention group and the treatment group. And the reason that there's really a good amount of agreement is that all of these therapies I've been talking about work best at the earliest stages of Alzheimer's disease, and particularly before we even called them Alzheimer's disease. Years ago, you had to be diagnosed with dementia impact before you can make a diagnosis of Alzheimer's disease. Well, for the last 10 years, we've had imaging studies based on amyloid that we could make a diagnosis. They've been FDA approved, and they were impossible to use because they weren't covered by Medicare. These antibodies gave a rationale for Medicare to cover them so we can make a definitive diagnosis of Alzheimer's disease even at the earliest stages. But again, it's high-tech technology, it's expensive, it requires radioactivity. But now we're seeing a very strong correlation between the newly FDA-approved blood tests for Alzheimer's disease. I'm still waiting for insurance coverage for that so I can widely use it in my patients. But the issue, everything we know so far is the earliest you intervene on these diseases, the better chance you have of slowing them down. And then I'm a believer in the resilience of the brain. And the issue is that if you can stop the pathologic changes, you give the brain a chance to recover. And we know that from stroke. We know that from head injury. All these things, the vast majority of people with a severe stroke will have, significant recovery because the brain's resilient. So that combination of prevention and cure are not different. They're a continuum.
Thank you so much, Dr. Fishman, for sharing that really important information. Again, those radiologic images were just really inspiring of what we could do. So now we're going to turn to Dr. Isabelle Aubert, a senior scientist at Sunnybrook Research Institute and professor at the University of Toronto. She is pioneering innovative research into the use of focused ultrasound for Alzheimer's, and we'll hear from her before diving deeper into her work, which I'm sure you will be incredibly engaged with.
Hi, everyone. My name is Dr. Robert, and I'm going to talk today about focused ultrasound and how can it protect and repair the brain. First, we have to understand the brain changes when it's affected by Alzheimer's disease. Brain regions like the hippocampus are severely degenerated, as you can see here, compared to the healthy side. And this is due to molecular and cellular pathology with amyloid plaque, tau tangles, and those affect brain cells, both neurons and glia, leading to structural changes of the gray and white matter, and all this together has an impact on brain functions. To reach the hippocampus, we use image-guided focused ultrasound. The patients are awake and responsive. The sound wave targets the hippocampus. It can also target other brain regions, and it has millimeter precisions. The ultrasound wave seen here with the whiter line can go through the skull, and at the same time, we inject microbubbles, and the interaction between the waves and the microbubbles make them oscillate and vibrate, and the therapeutic, that is the little blue dots here, can now seep from the blood into the brain. So the blood-brain barrier can be restored within few hours, and it's a temporary and mild effect. And through my presentation, when I say focused ultrasound, I will mean focused ultrasound with the microbubbles that are used for blood-brain barrier modulation. But first of all, we needed to understand better what does focused ultrasound with microbubbles does, even without a therapeutic. And these were our preclinical evaluation in the lab. What we found is that this treatment really reactivates the glial cells and make them engulf more of the amyloid beta pathology. And this was shown in the brain tissue and on the blood vessels. Furthermore, focused ultrasound promoted the regeneration of brain cells that you see here, responding to the blood-brain barrier modulation and dividing to generate new brain cells. When we add therapeutics to this treatment of blood-brain barrier modulation, it further improves the regeneration created with the interaction of the ultrasound. Here we can see in a preclinical model the regions where we deliver the therapeutic that is neuroprotective, and this can be done one time or repeated time to rescue neurons that are affected in Alzheimer's disease. For diseases like Alzheimer's that are taking place over decades, one of the visions that we have is to use focused ultrasound-mediated gene therapy. A gene carrier will carry the therapeutic and injected in the bloodstream with focused ultrasound will get into the brain. And this will be like a one-time treatment, one delivery that provide long-lasting production of therapeutic. And we can have a dosage that is low enough that we limit unwanted side effects. We can reach any brain region, and furthermore, focused ultrasound can be used for gene regulation, and we can also create those gene carrier to be responding to the pathology itself, so that we have an on-demand therapeutic approach. So at the end, our goal is to really give the chance to the brain to protect itself and heal itself. Thank you for your attention, and I would like to thank all members of the Aubert Lab who have been behind the scene doing this important work. Thank you.
Wow, Dr. Aubert, that's an incredible presentation, and the future is looking so bright, for having a potential cure with this gene therapy research. Can you talk a little bit more about this gene therapy research, and how close are you and what do you need to move this into clinical trials?
All right, thank you so much for the question. So for the gene therapy, first of all, I'd like to say that coming back to the first talk, even we heard that he's learning so much about not only the genetics, but the protein. So the more we learn about the different pathology, the more we can design that gene therapy better, because we need to get to those gene consequences that are important. So in terms of how close we are to the clinic, that's always a tough question. I keep it for the end. It's really, we have to go step by step on what is known now, what is safe to go in human, and move slowly. There was some gene therapy that were done with typical invasive intracranial injection. These will be the closest one that we can move into the clinic with Focused Ultrasound. But from there, like my vision is really to be ready for all of these new discovery on gene, on protein, on pathology of the brain. Like we talked about synuclein a little bit and other, it's not only amyloid beta and tau. So I want the research team and the clinical team to work together to be ready for the next transformational change in gene therapy.
Right, right. That's great. And I know your lab is also doing research on so many fronts with Alzheimer's. And in addition to the gene therapy and this pathway, I know there's some really interesting work with oligodendrocytes. And I was wondering if you could tell the audience about that path.
Of course, thanks so much. And I'm grateful to both the Focused Ultrasound Foundation and the BrightFocus Foundation for funding this innovative research. We often talk about neurodegeneration, but really the oligodendrocyte, they're the cells producing the myelin of the brain. And the myelin is the connection from the insulation, if we want, between the neuron axons from one brain region to the next. And that's how the brain communicates from cell to cell together. And we need to protect that myelin. And Alzheimer's disease is a white matter disease as well. So we really have to work on these brain cells. And what we've shown is like with Focused Ultrasound, it's not published yet, but it's coming soon. It's in bioarchive. But with the Focused Ultrasound, we can actually generate not only new neurons, but new oligodendrocytes, and they mature even in a disease model that we tested. So we have hope that we can also work on the regeneration of these oligodendrocytes.
Right. It sounds like there's a lot of work to do with focused ultrasound research on so many fronts, right? On the neurons, on the oligodendrocytes and blood-brain barrier opening. So thank you for giving us a window into the amazing research you're doing. At this point, we can now answer questions from the audience. Please continue to send them through the Q&A function and we'll share them with the panelists. Nancy, do you want to start off with some of the first questions? You're muted, Nancy. You want to unmute?
Sorry about that. As I've been looking through the questions in the chat, several of them relate to how can I get involved with focused ultrasound treatment? Can I participate now? When do we think this will be available? I know, Dr. Fishman and Dr. Aubert, that this is not something you can answer for sure, but can you give the audience a sense of whether they could participate, for example, in research trials, or and what to expect in terms of when this might be available more commercially to the public?
If people want to get involved in research, there is one website, clinicaltrials.gov, which it's not an endorsement, but it's a search engine, and it particularly, again, research in Alzheimer's disease, both with focused ultrasound and without, are active fields. It's a search engine. You put in Alzheimer's disease, focused ultrasound, and what it'll give you is the centers that are recruiting. The limitation is sadly money. This is like many new technologies, they're expensive. The issue is, of course, safety first, although frankly, focused ultrasound is dramatically safer. I think Dr. Aubert sort of said, gee, what's the state of the art of getting things into brain, gene therapy or stem cell therapy? The answer is the state of the art is a modification of the hypodermic needle developed in 1830, which is you drill a hole in the skull and you put a needle into it. That gives you very limited distribution and, of course, has the risk of bleeding into brain. So, whereas novelty and innovation is wonderful in science, it is a mixed blessing in clinical research. So combining experimental therapies like opening the blood-brain barrier with gene therapies, it's a go slow with this because you always have to anticipate there may be some So again, the technology is expensive. You have to watch people very, very carefully, which means how do you watch people besides clinical exams? Those are relatively cheap, but repeated MRIs and scans, you're talking about many thousands of dollars for a single patient, and especially to follow them over years. So again, you have to wash them like a hawk before, even these anti-amyloid antibodies have a risk of bleeding and swelling into the brain, having an immune reaction. So tight surveillance is needed.
Susie, do you want to go or shall I continue?
Sure. I have a question about that blood-brain barrier. We're getting some questions about how long does the blood-brain barrier stay open for, and what are the safety risks of opening it up? Perhaps Isabel and Dr. Fishman can both take that question.
Sure. Like Dr. Fishman was saying, like we need to be really, really careful in everything we do, from patient monitoring to the preclinical work, so that we have the evidence of safety and that we know it's good for the patient. So in terms of what we've seen so far, both in the preclinical model and in the patient as well, is the blood-brain barrier really reseals itself within few hours. So it can be as fast as 4 hours, and in patient it was tested at 9 hours, 12 hours, 24 hours. Not sure about the 12-hour, remove that was in preclinical model, but it's really within a few hours, and it can be done repetitively and it still will reseal. So again, we've learned more. Dr. Fishman talked about the plasticity and resilience of the brain for the blood-brain barrier as well. It used to be considered, and it is super important, and it has to be considered that way, but it is also, in my research through that over the last many years, I found it's very much plastic, like other parts of the brain as well. There is some plasticity to it that I did not appreciate before. So I think we need to change some of the textbook a little bit on that.
Dr. Fishman, do you have anything to add?
Well, I think the issue is safety. The machines have to be well designed and monitored, because if you open up the blood-brain barrier too much, now you're going to have toxic aspects of blood and even bleeding into the brain. And so all the preclinical work that Dr. Robert is talking about is developing parameters, developing monitors to make sure that the blood-brain barrier is opened for that brief period of time and closes normally after that.
I want to remind everyone that the Focused Ultrasound Foundation had an Alzheimer's disease workshop. It's about 2 years ago now, I think, where we convened experts, and we really had 50 to 60 experts in this field sit in a room and talk about how do we proceed safely with clinical trials? How often can we open the blood-brain barrier in each patient safely and effectively, and have standardized reporting standards as well? Because now there's about 4 or 5 companies in the space that can do blood-brain barrier opening in clinical trials, some inside an MRI machine, some outside the MRI machine. So the FUS Foundation is really working hard to move this field along in a logical, clear, and safe fashion. Nancy, do you have any questions for the panelists?
Yeah, I think it's really interesting because we think of focused ultrasound and as opening, but gene therapy, I didn't necessarily make that connection. And I wanted to go to Lauren because early onset Alzheimer's, which Lauren's mom and grandmother and grandfather all had, does have a genetic risk factor. And so as someone put in the chat, Lauren, as a caregiver and a person at risk, potentially genetically, what do you think are the areas of unmet need in research? I know you and Seth are very focused on providing support for caregivers and respite for caregivers and information to younger people. But do you have a thought about where you'd like to see more research being done?
Oh gosh, I mean, we don't dip our toes too deep into the research phase, but and to clarify, my mom did not have any of those, like the PSEN1 that causes from, really early onset. She had 2 copies of APOE4. I think personally, I think that the research that's happening is always mind-blowing, but I think that early detection is probably where I, would love to see a lot of effort and money, because I think that the earlier you can intervene, the longer you can potentially prolong the the earlier phases, which are, you can really maintain a very wonderful well-being in life in those moments. And so I think that earlier interventions are key.
And that has to do with making the public more aware and trying.
Sure. I think that the earlier we can get people into trials, then the more information we have. And so I think that, again, it all goes back to conversations so that people that have been diagnosed or having these conversations with their doctors can dig even further. Perhaps you have a doctor who doesn't know about all of the information that's out there. And so, again, the more that's available, I think, to people early on, the better.
And I think I'm going to turn it over to you, Susie, but I just wanted to say, I think it's really important because someone did put a question in the chat about, or saying that they're going to their doctor and their doctor is basically telling them kind of, I don't know what's wrong with you, or there's nothing wrong with you. And this happens so much. So to the audience, be persistent. And there's a lot of organizations like BrightFocus and others, and HFC and others, that have information about how to talk to your doctor and what to ask them to do in terms of testing. And if your primary care person is uncomfortable with that or doesn't seem to want to help, go to somebody else. There's so many things that you can do now. This is like a golden age, and trials that you can participate in, as we've discussed. And in addition to clinicaltrials.gov, BrightFocus has also a trial finder that's a little bit easier to navigate, but there are several of those around as well. Go ahead, Susie.
Yeah, no, Nancy and Lauren, you were phrasing that perfectly, that, early detection is so important. We don't even know the full effect of all of these clinical trials that are on these early patients because we don't know about them yet. The radiologic studies pick it up a little bit later, but hopefully these blood tests will pick it up earlier. So we really need to get those reimbursed and start using them for entry criteria into clinical trials to get more patients into clinical trials and know how these new emerging therapies can try to halt and or reverse the disease at the early stage. So thank you for talking about that and bringing that to everyone's attention. And Lauren, your documentary is clearly bringing the conversation so people are aware of it, can talk about it easier, bring it to their clinicians like Nancy was saying. So this is all super, super important. So thank you for bringing that up. Nancy, do you have any other questions?
Oh, gosh. I'm going to throw this out, I think, to everybody. What do we think needs to change the most in how society supports families living with Alzheimer's? I know I'm going off the research a little bit, but just a couple of thoughts maybe on societally, what needs to change? What can people do?
Okay, I'll take that one since I guess I've been struggling with this both for personal and professional reasons for many decades. And the issue is support for families in their homes for them. The sticker shock that I get from patients who ask about, does their insurance cover home care? Remember, Medicare doesn't cover assisted living. Medicare doesn't cover nursing homes. People have to spend down to poverty levels. And then, the Medicaid is not funding welfare queens. Medicaid is funding the elderly, demented people who have basically had to spend down to poverty levels to stay in their nursing homes. So again, and there's very little support for in-home care, even though every study says there's less morbidity and it's probably less costly. So again, the expression in my field is, you've seen one patient with Alzheimer's disease, you've seen one patient with Alzheimer's disease. Give families choices on what works best for them.
I could add to it, but honestly, that was so well said that exactly what I would say, which is the support for family caregivers can change, and there is much change to be done from a federal level. That probably won't happen for a couple years. State to state, there are things that are happening, But to me, that's the biggest need is support for family caregivers across the board. We are, as a society, failing our caregivers and could be doing a lot better job.
Thank you. Thank you for those words. And very quickly, with World Alzheimer's Day approaching on September 21st, I would like each of the panelists in 1 or 2 sentences to think what is the most important message we can send to the public right now in terms of hope and urgency. Lauren, you want to go first?
Sure. I mean, I guess I said it before. I think my one message is always share your story. Change doesn't happen in the darkness.
Okay, well said. Dr. Fishman?
Public awareness and have honest conversations with your doctor. And if it's a big marketplace, if you're not happy with how things are happening, there are plenty of other places too.
And Dr. Aubert?
Yes, I'd like to echo both of them. First, like I think well said, and also in terms of the research, then we go into education and public awareness and how to help to get these novel treatment into the clinic and make the biggest impact for the families and the patient.
Okay. Well, thank you all. I think that was a fantastic hour, and we definitely hit on some of the key points, but as everyone says, keep the conversations going with your friends, with your family members, with anyone who will listen. On the street corner, like when you saw Dr. Isaacson, just continue the conversations. So thank you again to the panelists, Lauren Miller Rogen, Dr. Isaacson, Dr. Fishman, and Dr. Aubert, for sharing your stories, your expertise, and your passion. You helped bring a lot of humanity and definitely a lot of hope into this conversation. Nancy?
And thank you to everyone. Thanks, Susie. And thank you to everyone watching today and being proactive and listening and learning. And I'm overwhelmed with all the questions that we couldn't answer in the chat. So hopefully we'll be doing more of this together. I love doing this with Focused Ultrasound. So your presence watching this as supporters and as listeners reflects the commitment of our community, our donors, clinicians, researchers, family advocates to advance Alzheimer's awareness and progress, real progress now.
So don't forget, World Alzheimer's Day is around the corner. Keep the conversations going. Share what you've learned today. Support the caregivers in your community. Continue to raise awareness. And if you want to consider making a gift in advance for these life-changing treatments, please do so. We need your voice. We need your support. And as you see, every patient, we can make a difference for them and their families.
Yeah, and as I think we know, there's been a lot of research kind of holdbacks at the government level this year. So private support is more important than ever for research and for caregiver support. So thank you. And on behalf of BrightFocus Foundation and the Focused Ultrasound Foundation, thank you again for joining us. We're looking forward to updating you as the science and advocacy continue moving forward. And until then, please take care. I always say hug the people you love. Life is short. And stay inspired.
No, thank you, Nancy. And thank you to the BrightFocus Foundation for doing this webinar with us. Please visit our websites at brightfocus.org and fussfoundation.org to learn more about Alzheimer's disease and our organizations. Actually, both of our websites have good clinical trial finders as well. So please look on those websites. Stay tuned to our newsletter and websites for invitations to future online events. And everybody have a fantastic day. Thank you so much.